Hey guys, how you doing? 8 p.m. on a Wednesday, a little later than normal. We're going to talk tonight about erectile dysfunction. And people say, wait a minute, Dr. Huber, you're the health guy. You're diet and exercise. What are you doing talking about erectile dysfunction? We're going to talk about erectile dysfunction because it's absolutely central to your heart health and your longevity. So stay tuned. We're going to be right back and we're going to nail it. I'll see you in a little bit. I just marinated it in plastic. We don't like plastic, we like glass. Why do we care about all this plastic? What's the big deal?
It's a toxic bomb.
Our whole practice is based on getting you to be the best version of yourself.
Remove the crappy foods, the wheat, the dairy, the sugar.
Everything we do is based in the medical literature and evidence-based medicine. We're going to look at how to get you healthy, not how to get you on medicines, how to get you off medicine. There's a couple of very curious things that CBD oil does, helping people with migraine headaches reduce the frequency and intensity of their headache. People that have ADD or ADHD, anxiety or mood swings or depression. These things can help decrease anxiety and make a child more calm. Lyme has been found from coast to coast. 50% of all counties in the United States have Lyme disease documented. All right, game on. We're going to talk about erectile dysfunction. Why? Right? Why is this an important topic? Erectile dysfunction is central to your health. I know you're not from West Virginia, and if you are from West Virginia, then you'll understand this very clearly. What is the canary in the coal mine? What does that mean? Well, coal miners would take a canary into the coal mine, and if the bird got sick, it was telling them something's wrong, I don't know what, but we better get the heck out of here. Erectile dysfunction is your canary in the coal mine. You're not alone. First of all, let's wipe away embarrassment. More than 50% of guys will experience erectile dysfunction. Not when they're 80, when they're 30, 40, and 50. You're not alone, and you're not unique. So don't be embarrassed by it. Accept that it's a significant sign of something that could potentially be wrong. When we talk about erectile dysfunction, I want you to think about the 50-50 rule, all right? If you have erectile dysfunction below the age of 50, you have a 50-fold increase in the risk of heart disease. What we want to understand is that erectile function is really a blood flow issue. And if you're having blood flow issues in that area of your body, then you have blood flow issues everywhere, in your heart, in your brain, your carotid vessels, your kidneys. And so that's why it's the canary in the coal mine. If you're having ED, it's a sign that your blood vessels aren't healthy. And we're going to talk about what is the driver for erectile dysfunction. There's another rule that 70% of people that go on to have heart disease had erectile dysfunction first. What does it say about your health if you're 30, 40, or 50 and you already got some sign of ED? First of all, you can correct it. First of all, I'm going to show you how to reverse it. But it's a sign that your blood vessels aren't healthy. Okay? Now we're going to talk about, there's three different things. There's three different components to why you might be having erectile dysfunction. Before we get into those, I want to point out, guys that have good erectile function, it supports their relationship. Intimacy is key, right? We marry for a reason. Our spouses are very important to us. When we lose that connectivity because of erectile dysfunction, we lose confidence and we lose a very important part of our life. Studies have shown people that live the longest have good social networks and have good marriages and good spousal relationships. So having a relationship with your loved one is just that. It's key. It's important. So this is not some off the topic, horn dog guy kind of thing. It has more to do with the fact that erectile dysfunction is a sign of something very central. So let's get into the deep water, all right? There are three things that are very key to erectile function. Most guys would say, well, it's testosterone. Not necessarily. I could fill this room with an army of guys that have normal testosterone and have low erectile function. Let's go to the top, the first graphic Chris is going to put up here. The very first thing is blood flow. Notice it's not hormones. There are three things involved. There are hormones, there's blood flow, and there's your neurologic system, the nerves. All three of those have to be working. And any one of those three could be the culprit in why you don't have good erectile function. So let's go to the top one. We'll talk about blood flow. That's what an erection is. So the penis is nothing more than an implement that holds a lot of blood, and that's what makes it erect. But if the vessels feeding the penis are altered by inflammation, sugar, oxidation, these are the things that cause problems, right? It isn't just cholesterol. But if you have high blood pressure, if you have diabetes, if you have a bigger belly than what's ideal, all those things are having a negative impact on the blood vessel. The penis, as a cavernous space that holds blood, is fed by hundreds of little circumflex and emissary vessels that need to feed that compartment. But if those vessels get damaged, let's just make up a number. Let's say you have 100 vessels feeding that area with blood, but 30% of them are altered or damaged because of high sugar or oxidized lipids or inflammation in your vascular system, then your erectile function is going to suffer from that. Let's restore those. We can. There's a number of things that we can do, that we do in this office, to restore the blood flow, okay? Number one, there's a device right over my shoulder here. So this device here is a Storz percussive device. Some people call it a Gainswave device, but it's actually a Storz percussive device. And what it does is it provides micro trauma to the area involved. You can use it, actually there are studies being done using it on the heart to increase blood flow. But what it does is it creates micro damage and it breaks up micro plaque in these vessels. We talked about those 100 vessels. We made that number up. But let's say 30% of them are damaged. This device can break up those microplaques and recruit growth factors to help stimulate new blood vessels. There are other things we do in our office to stimulate more blood vessel growth, which is called angiogenesis. So there are things we can do to help restore damaged blood vessels, create new blood vessels, and there's a multitude of different approaches we take to do that, okay? So understand, there's a way to repair and fix that. That's the core, because a guy might say, well, I don't need that. I just do Cialis, or I just do Viagra, I do, tadalafil, and I'm fine. But the problem with those medications is they tend to have a reduced effect over time. When you're using things like Cialis and Viagra, they may work today, but if you don't fix the problem, which is the blood vessels, they're not going to work as well next year or the year after or the year after that. And some studies are showing that use of those medications, although good for blood flow, are not so good. They're related to skin cancers like melanoma. They're even associated with some visual problems. So those medications are okay, but we want to get to the heart of the problem. So we talked about blood vessels. What's the next one? Hormones, right? So you look at that triad, that triangle, those three things. Hormones is a big part of it. And it isn't just testosterone. Notice I may have testosterone at the top there, but right below it is cortisol and thyroid. If I want to ruin your erectile function, why would I do that? But if I wanted to ruin it, I would stress you out. I'd make you work long hours. I would interrupt your sleep. I'd put more on your plate than you can handle. That stress is going to cause a cortisol response, a stress response. And under stress, we've talked about this a little bit in other videos, under stress, as an animal, the human condition says, whoa, we're under stress. Shut off hormones like testosterone, shut off thyroid function. We don't need those. We need sugar and we need cortisol to survive this fight. So if you're having physiologic demand that raises your cortisol, it's going to erode your testosterone. It's going to hamper your ability to make normal testosterone. And if you're 30 or 40 or even 50 years of age and you have low testosterone, I'm here to tell you, like we talked about last week, you probably don't need testosterone. We need to fix why your testosterone is underperforming. And we can do things to stimulate your body to regenerate your own natural testosterone production. First of all, it's the most efficient way to do it. It's the least expensive way to do it. It's probably the healthiest way to do it, okay? So we talked about blood flow. That's very key, probably the most important. We talked about hormones. I have an army of guys that come in and they're getting testosterone pellets or testosterone therapy, or I have normalized their testosterone and yet they go, Doc, I'm still not having good erectile function. So it isn't all just testosterone deficiency. And then the last arm of this, the last phase of this triangle, is your nervous system. It takes all three of those to work well for you to have good erectile function. And what do we mean by your nervous system? Well, there's your central nervous system and your peripheral nervous system. For your central nervous system, your sympathetic and parasympathetic nervous system, they have to be in balance for you to have sex drive. There's an old adage that's, of course, a little bit sexist, but it's true for men and women. The adage goes that a man will have sex to relax, but a woman needs to be relaxed before she can even think of having sex. I find that's true for men just as it is for women. Men that are stressed. I have corporate execs that come in and they're high flyers and they're traveling all over the country and they're under a lot of pressure. And you know what? What they tell me is, sex, I'd rather have a sandwich and a nap, right? So if you're stressed and your physiologic demands of your schedule, of your life, is having an impact on the nervous system, that's going to affect your ability to have an erection. So that's the other key component. And if you're that guy that has high stress, therefore high cortisol, high sympathetic nervous system tone, even if these words don't truly resonate with you, there are videos on our website. There are articles on our website that talk about it, and we need to work on that. So when a guy comes in with ED, yes, we look at testosterone, absolutely. But we also look at cortisol, we look at thyroid, we look at blood flow, we look at hypertension, diabetes, metabolic syndrome, belly fat, because all of this collectively is playing a part. And then we look at that nervous system and we say, what is your sympathetic parasympathetic balance? Is your nervous system calm? And I can actually show you how to measure it. I can give you a number and you can look at your nervous system and say, oh, it's tuned perfect. Or you can see when your nervous system is left of center. And there are definitely things we can do to get it back on track. So the reason I bring up this topic tonight, it is key. Your erectile function is a direct reflection of how healthy your blood vessels are. If it's not great, first of all, don't be embarrassed. I've already said, most guys, the majority of guys, are going to have some problem with this at some point in their life. If you're getting a little belly fat and your blood pressure is up and you're diabetic, your risk is even higher. But the erectile dysfunction preceded or often preceded those problems. Or your diabetes is contributing to that problem. But don't be deluded into thinking that erectile dysfunction is just testosterone. It's not. It's a marker of a lot of other things that may be out of whack, right? That can be changed by lifestyle, by diet, by sleep cycle, sometimes by supplements, sometimes by medication, but we need to get those things in line, because if we don't, that erectile dysfunction is speaking volumes about the status of your heart, the status of your brain, the status of your carotid vessels, and the blood flow to your kidneys. And if we don't fix it today, that means a year from now, 5 years, 10 years from now, we may be dealing with much bigger issues, all right? So, number one, if you have an issue there, call our office. I want to see you. I want to help you peel back and see what's really the driver behind this. I want to get that function restored, whether we use GainsWave or whether we use any other therapies. I want it restored, because when that function is good, your relationships are good, right? Your confidence in yourself is good. Your cardiovascular health is better. And that's what we're really interested in. I want you to live long. I want you, as I've always said, 80 years old on the golf course, not 80 years old in a nursing home. And if you're having problems and you're only 40 or 50 or early 60s, let's get it fixed so you can stop the erosive nature of this issue in your body. Let's fix it. Let's repair it. Let's make your life a celebration. Let's make you have excellent days and excellent times and excellent relationships, okay? So hopefully I've begun to peel back some of the issues related to erectile dysfunction. It's funny how people respond to that. They get embarrassed, or people say we shouldn't talk about that. No, we should talk about that. It's a part of your physiology. You wouldn't go every day with headaches and not talk to anybody about it. You wouldn't go every day with ankle pain and not talk to somebody about it. This is an important part of your physiology. We want to be there to help. My dietitian, Chelsea, is there to help support dietary changes so we can get your sugars under control. We've talked before in videos. If you're a type 2 diabetic and you're on insulin, we can probably 99% possibility get you off insulin, and that's damaging your blood vessels. Why not reverse that and get those blood vessels to be healthy so that erectile function be good, okay? So, an important topic. I hope I've at least stimulated some conversation that'll make you think about what do you want to do moving forward. If you have curiosity, call my office. Area code 513-924-5300. Go to my website. Lots of information there. There's videos that Chris has helped us produce, talking about general health, talking about diabetes, talking about sleep, and all these things that are related. And the video, or the website, is Huber, Huber, that's my name, PM, HuberPersonalizedMedicine.com. Go there and explore. Go to our Facebook, Huber Personalized Medicine Facebook, and look at all the videos we have. Go on YouTube. We have a YouTube channel. How about that? I'm semi-famous. Dr. Gary Huber at YouTube. But educate yourself. Arm yourself with good information so that you can make good decisions about what you need to do to improve the quality of your life so that you're 80 and on the golf course. All right? I hope this has been helpful. I hope it's opened up some discussion, maybe for you and your spouse, maybe for you and I in person, maybe for you and Chelsea to talk about what you can do about diet. But if nothing else, I want to blow the lid off this and begin to create that conversation so that you feel comfortable and get the help that you need. All right? So, if you have any questions, please feel free to email me, log into the Facebook page, ask a question. I guarantee you we're going to give you a response. I hope this has been helpful tonight. And I have no idea what we're talking about next week, so throw me a topic. Throw me something you want to hear about, something you want to talk about. I'm happy to discuss it. But again, thanks for tuning in tonight. I hope this has been helpful for you. And have a great evening and have a great sex life. All right? Take care, guys. Bye now.